that all of you could tune in today to learn more about how we at the Bengtson Center are working hard to elevate your surgical experience. Today's program is going to go over some of the recent advances in technology that we utilize in order to facilitate the easiest recovery possible for a variety of procedures. I'm really happy that everybody could tune in today, and I'm going to talk to you about some of the specials that we're providing too as a benefit of viewing the webinar. So we always talk about the importance of credentials when it comes to picking a surgeon or a surgical facility and the procedure. My credentials, as you can see here, revolve around my extensive experience in plastic surgery and specifically cosmetic surgery. In addition to being certified by the American Board of Plastic Surgery, in April of this year, I was inducted into membership into the American Society for Aesthetics and Plastic Surgery, which is comprised of a very small percentage of plastic surgeons in the United States that have dedicated their practice to solely cosmetic surgery, as well as performing research and being involved in numerous societies. You can see down below some of the other awards and recognitions that I've been proud to achieve over the course of my 13 years in practice here in West Michigan. So why choose the Bengtson Center for your next cosmetic procedure? Well, between Dr. Bengtson and myself, we have over 35 years of combined experience in plastic surgery. We have a nationally accredited ambulatory surgery center where our procedures are performed. This meets and in often cases exceeds the health and safety standards of outpatient surgery centers affiliated with hospital systems. And our practice is in the top 1% of practices in the United States in terms of its utilization of products from Allergan, where we buy many of our pharmaceutical products from, but also breast implants. So one of the things we want to emphasize today is how to get back to your life as fast as possible and as safely as possible following a cosmetic procedure. And as you're probably well aware, different procedures have different recovery times based upon their level of invasiveness and the time. One of the things that we like to talk about to our patients is called the Fast Track Recovery Program. This deals specifically with breast surgery and utilization of breast implants. The Fast Track Breast Recovery Program revolves around a philosophy of being as atraumatic to the tissues as possible and starting patients on medications before surgery to help with pain and discomfort. In addition, afterwards, we have an exercise regimen. It's very light that we have patients do revolving their arm motion. All of these things factor into play to increase the recovery in terms of the time back to normal activities. Currently, it's really pretty much the state of the art for our practice and our patients to be able to return to all normal physical activities within 24 to 48 hours following their breast augmentation surgery. And by normal activities, I refer to getting up, walking around the house, getting yourself dressed, and being pretty much independent. This program has made the recovery from breast surgery incredibly good, up to the point now where we very rarely ever prescribe actual narcotic medication for our patients. It's really just a light painkiller. Most patients are very comfortable and just feel tight afterwards. The Fast Track Recovery Program utilizes medication that we start you on before surgery, as well as the technique in surgery to minimize trauma to the tissue and look directly at the implant pocket that we're going to create by lifting up your muscle. We do this with the goal of having very minimal to no bleeding during the surgery. The benefit of that to you is that there's less tightness and soreness afterwards. And at home, you do your part by using your arms, getting up, walking around. It's not unusual for some of our patients to actually go out that night, go out to dinner or take a walk and be out with someone, a responsible adult chaperone. We're very proud to offer this here. We've been offering it for years, and it has really revolutionized the recovery following breast surgery. Other technological developments that have been extremely important when it regards to implants is the Vectra 3D imaging. If any of you have done any reading or experienced this, the benefit of this is that it allows our 3D camera to obtain images of your breasts while you're at your consultation. This allows us to very accurately simulate for you what your implants would look like in your body, as opposed to just stuffing an implant in a bra, which can be somewhat inaccurate based on a lot of factors. The camera is very accurate. It takes into account a lot of factors such as your chest wall, any irregularities or asymmetries in your breast tissue. It's a really great feature for patients because they can leave the office looking at images of what their breasts would look like after surgery. This allows them to feel more confident and comfortable moving forward for their surgical plans. In the next slide, you're going to see here that this is an image of a patient on the top who had a simulation, a 3D image simulation. This is from the top-down view. And below that is the patient who actually had the implants put in, and after an adequate amount of time to allow for swelling and healing, to see how accurate the images can be for this particular patient. So in the right patient who doesn't have a lot of breast tissue or a lot of loose, stretchy skin and whose nipple is in a good position, the imaging is very accurate and patients feel very comfortable and confident when they've received the imaging that their image afterwards, their body will look very close to what they have seen from their virtual imaging. Another very important factor is in your recovery is health and nutrition. So we talk to our patients about optimizing your diet and nutrition prior to surgery. In partnership with the local medical practice, we've also been able to have develop an incredibly effective vitamin pack that we give to our patients before surgery and encourage them to continue taking afterwards. This is very important because healing involves your immune system, and if your body is healthy and not depleted of any vitamins and minerals, you're going to heal faster and feel better and actually look better faster. The recovery kit is really excellent. Patients have had a really good experience with the vitamin pack. Typically, we start it a couple weeks before surgery and have you continue it until afterwards. And many patients who have had previous surgeries years ago prior to this implementation have said that they felt their recovery was better. In addition, it also involves some compounds that help with bruising. So for those patients who are having procedures that are slightly more prone to bruising, they've found that the recovery vitamin complex can be very helpful in achieving their goals of getting rid of bruising faster. For other patients who may have more nutritional depletion or needs, such as are really patients who have had significant weight loss, oftentimes through surgery, we also partner with this practice of the Bourne Clinic to offer them vitamin infusions prior to surgery. And I know anecdotally with one of my patients who had weight loss, she felt like her recovery was significantly easier than she was expecting it to be or has had from other surgeries after she received her IV vitamin infusion prior to surgery. It's not required, but it is something to think about for patients who are struggling to maintain a good level of a lot of these essential nutrients in their body. And I've seen firsthand the benefit that it can provide for patients who consider doing it ahead of time. So in regards to body contouring, which is a significant part of our practice here, body contouring refers to specifically liposuction and also abdominoplasties, but also other areas of the body. The image you're seeing now is one of our anesthesia providers performing what's called a TAP block, and that stands for transverse abdominis plane block. The patient in this image is asleep, and the anesthesia doctor is using our ultrasound system, which we utilize very frequently in your care and technology, to visualize the abdominal wall muscle layers. So the abdominal wall muscles are what we see on the really fit Baywatch lifeguards who have six packs. During this procedure, the anesthesiologist is injecting a long-acting local anesthetic into the exact muscle layer that the nerves travel in. The nerves are what give your body the sensation of pain and discomfort after surgery. By visualizing them very accurately with the ultrasound, our anesthesia providers can isolate their location and provide the local anesthetic into that area. The great thing about this medication that they inject is that it lasts about 3 to 3.5 days. This has dramatically improved the recovery and allowed patients to be up and moving much, much faster than they used to be prior to using the TAP block. In addition, we've also found that patients are much less likely to continue using prescription pain medication past a few days when they've achieved this. We've achieved this pain control with the TAP block. Again, this is done with patients asleep and patients are unaware and don't feel anything. It adds a little bit of time to the procedure, but the recovery has been so much more improved in that it allows patients to get up and walk much faster. We're really proud of the fact that we're able to utilize our technology to implement this for our patients. All patients who are undergoing a full abdominoplasty or any type of muscle repair undergo this procedure as part of their plan because of the improvement has been so profound in their recovery. Another aspect of technology that has been a game changer when it comes to body contouring is the development of the Interi system. This is the next level of advanced technology in regards to removing fluid after surgery. If you've had surgery or know people who've had surgery and have talked about the fact that some of them have had drains after surgery, which are used to remove fluid from areas typically used with tummy tucks or abdominoplasties, but often other procedures. The Interi system is a brand new technology that utilizes continuous negative pressure. And what that means for patients is that the tissues are being pulled to one another internally in a much more vigorous fashion than a traditional drain bulb. The benefit for you is that you heal faster, you decrease the fluid production faster, and we've even seen that swelling in terms of how patients look appears to be better earlier on because the suction is actually reducing some of the edema or swelling in the skin and the fat layer. We're very happy to provide this technology to our patients, and it was launched in the late summer of 2020, and a handful of other surgeons across the country are also utilizing it and have found similar results and have been very happy with it. All of this helps to increase your healing potential, decrease the risk of fluid accumulation, as well as potential complications that accompany that. The system is removed typically at your first visit back in the office somewhere between 7 to 10 days after the surgery. I had mentioned ultrasound earlier and how many aspects of plastic surgery now really benefit from the use of ultrasound. One of them is implant monitoring. One of the great features of having surgery at our practice is that if you undergo surgery, augmentation surgery, you are enrolled in basically our lifetime imaging program. What that does is it allows us to use ultrasound at the bedside to image your breast implants. If you look at this graph, the only other modality that's used from a radiological perspective currently is MRI. And as you're aware, if you've ever had an MRI, it's not quite nearly as portable or as easy to undergo. So comfort level, obviously, with a high resolution ultrasound, you're wide awake, you're in a big open exam room on an exam table. Whereas in MRI, you're in a coil and it's a somewhat confined space. Cost effectiveness is extremely better with high resolution ultrasound because it's our system, it's done at the bedside, and it's part of what we offer you as becoming one of our patients. They both can detect the shell rupture, meaning that they can see when the shell is disrupted. And that's a clue that the shell of the implant may have failed and that the implant is ruptured. When we do find that, we often will do a confirmatory test with an MRI and schedule surgery after we have that confirmation. The high resolution ultrasound has given lots of patients peace of mind who have maybe noticed something different about their breast, the way it looks or perhaps the way it feels. And the ability for us to image them here in our office saves a lot of trip and time down to a hospital system for an ultrasound or an MRI test. We're very proud and happy to be able to provide that to our patients. So let's move on to look at some actual before and afters and some clinical pictures. How do all of these things that I've just talked about play together to offer patients great results and improved recoveries? First, we'll talk about a mini tummy tuck. So this patient in particular was a great candidate for liposuction, which involves removing fat only and not skin. Our liposuction technology uses power-assisted liposuction, which is also called PALS. The benefit of this liposuction for patients is that it removes the fat more efficiently. In my experience, it causes much less bruising than traditional liposuction or other modalities of liposuction, and allows patients to have a more comfortable experience in terms of the recovery. In addition, in this particular patient, I did decide to remove some skin very low, just right where the photo underwear line is. So she does have a lower scar. And in some patients, this is kind of what we call a hybrid procedure, where it utilizes both liposuction in addition to skin removal. As you can see here, I focused on her hips and the what we call the flanker hip areas, as well as the front part of her stomach. Her incision is very low, typically right around where the top of the photo underwear rests. And we like to design the incisions low because we know that women wear typically bikini bottoms or underwear that are slightly lower cut. And this allows us a lot more opportunity to hide the scar for them when they're wearing a two-piece suit. As you can see in this patient's photo, she has much better improvement in the shape and contour of her abdomen. One of the things that we like to do is emphasize the natural contours that exist in a fit, athletic abdomen and try and bring those out to the surface with liposuction. Her photos are about 8 to 9 months out after surgery because that allows adequate time for the vast majority of all the swelling to be removed from her body. Here's the same patient from the side view again, that you can see that in addition to her artwork, she also has an improvement in the shape and contour of her abdominal area. It's flatter. If you look at the upper buttock area, she has an improvement in the shape just above the buttock area. And this is another slide. You can see here that she has quite a good improvement in what we call the hip or flank area. This is an area that we really like to address at the time of surgery. If you think about how clothing fits and basically our bodies are shaped, we're basically cylinders. We're round, we're three-dimensional. And if you address the back part here with liposuction and or skin removal, it's going to enhance the overall shape. That's a very important component to body contouring, is not looking at a patient's body in a piecemeal fashion, because realistically, we want to achieve a nice, natural, and harmonious blend all the way around the body. And by addressing the back part with liposuction and sometimes skin removal, it allows us to achieve that. In addition to, for a patient like this, when she wears clothing, she's going to have a dramatically different feel about how the clothing fits around her waistline. So you can see she has good skin quality, and that makes her a good candidate for liposuction back in this area. In addition, we'll often do liposuction above the hip area in what we call the bra roll, which was performed in this patient as well, to help smooth that area out in addition. The goal is to create and get patients to as natural of a shape as possible and close to that ideal hourglass feminine shape that we can achieve for them. So as mentioned before, patients sometimes are candidates for mini tummy tucks or what we call modified tummy tucks. Other patients are candidates for what we would consider a full tummy tuck, often included with liposuction. If you look at this patient here, she had concerns regarding the loose tissue around her belly button, both above and below, and she didn't like the overall shape of her waistline. If you look on the opposite side, you can see here her post-operative result. She has a new belly button that I've created and helped to shape. She also has improvement in the overall width of her hips and the loose skin in the front of her abdominal area. This is the same patient from the side view. In this patient, I did what's called an extended incision, meaning that I also took skin out around her waist. I did that because, as I just alluded to earlier, I want to maximize the improvement in contour and shape for this patient. And oftentimes that means extending the scar a little bit to the back or upper buttock area in order to lift that area, but also remove extra tissue around the waistline. You can see here her profile view is significantly improved, and part of that is the muscle tightening that we also discussed earlier. Here's another view of the patient from the back. You can see some of those scars. They're still a little bit pink. She's about 8 to 9 months out from surgery. Those scars continue to fade as she gets up to a year and past that. But if you look at the shape that I've been able to bring out for her, this was achieved with both liposuction and removal of skin in the back. And she has a nice improvement, definitely feels different in the way that clothing fits and the amount of tissue that she's carrying around. This area is often kind of termed that muffin top, which is very frustrating to patients to deal with. Even those who diet and exercise can still have a lot of fat and skin in this area, and that's why surgery can be so effective. Here's another patient, again, same concept, full abdominoplasty with liposuction, and you can see her side view as well, where her muscles were a little bit weak and she had tissue that was kind of hanging out in the front. The muscle repair and skin tightening of the front really does a great job in creating as natural and smooth and tight of an abdominal wall that we can achieve with surgery. Here's her back view. She had skin removed all the way around, what's called a circumferential abdominoplasty, or it's also called a body lift. Patients who have had massive weight loss, meaning over 100 pounds or more, often are candidates for this surgery. And the benefit for her was that it allowed me to remove both skin and fat in the back area to create better shape for her. As you can see, the scar has healed very nicely in the back. It blends in with her natural skin contour. Here's another example of a patient who had surgery, again, liposuction and full abdominoplasty, as well as the tap block. She also had liposuction of her outer thighs. If you notice that her thighs on the post-op view, you can see an improved contour there. Again, that's one of the problem areas that women often will complain about. Men and women tend to carry fat a little differently, as you're probably aware, and we have our so-called trouble areas. And those are really describe the areas that, regardless of our weight and our diet and exercise, our bodies tend to hold onto fat in this area very stubbornly. And they don't really reflect the amount of effort patients put into weight management and diet and exercise. The benefit is that surgery is extremely effective in those patients at contouring those areas. And the outer thighs in this patient was one of her trouble areas and her concerning areas. You can see she has much better muscle definition in the front, and that's in part related to the abdominoplasty as well as the liposuction. This is her side view. Again, a flatter abdomen. If you look at her buttock area, liposuction was done just above the buttock to help shape that area and remove extra fat in that region. And this is her from the back view. The incisions in the back for her are tiny. They're literally about 2 to 3 millimeters and blend in very nicely with her natural skin. And those incisions are used for the liposuction component of the surgery. Here's another patient, again, had concerns regarding extra skin and fat all the way around. And she was a great candidate for liposuction in the back, as well as a full tummy tuck in the front. You can see here her scar blends in nicely to the natural contours of her waistline, and she has a much more defined abdominal wall muscle layer afterwards. Here's the same patient from the side view. Again, you can see that hanging apron of skin has been removed. She's about 7 to 8 months out from surgery, and she may still even have some slight improvement in swelling as time goes on, but really she's gotten rid of the bulk of her swelling at this point. Here's another one of my favorite shots. It's the back view. You can see what a difference the liposuction in the back area or the flank, how that accomplished much more creation of an hourglass shape for her when compared to her preoperative state. And that's what patients really enjoy the benefits of, that, again, we're contouring all the way around. We don't look at patients in 2 dimensions. We look at them in 3 dimensions and determine the best surgical procedure to really bring out the underlying shape. Another example of a patient, full abdominoplasty or tummy tuck with again, new belly button as part of the procedure and liposuction of her waistline. You can see much better definition of her abdominal wall muscle layer here, as well as shaping of her waist. This is her from the back. Another thing that I did for her, which is a nice procedure to have performed, is called fat transfer. So I took out some of the fat from her hips and I actually injected it into her buttock area. This helps patients, for patients who are trying to achieve a little bit more definition of the buttock area and fuller rounder projection of the buttock. And it works out very well because the fat is right there. It's done in the operating room at the time of the procedure, and it helps enhance the projection of the buttock. Let's move on to breast augmentation surgery. As I spoke to earlier, again, one of the most common surgeries performed in the United States, and certainly one of the most common ones performed here at our facility. We've talked about the Fast Track Breast Recovery Program, which has really revolutionized the recovery regarding the procedure. So currently, the state of the art, typically we use and recommend silicone gel breast implants, which are smooth and round, as you can see in this photo. The silicone gel implants have a nice smooth outer shell layer, not textured. They're round, so if they move in the body, the shape always stays the same as round. There is a variety of projections of implants, which refer to how round they are, and we determine that based upon patients' goals for surgery, as well as what their Vectra 3D analysis shows us. Here are some before and afters of patients who've had breast augmentation surgery. All of these patients receive surgery with silicone gel breast implants through the incision in what we call the inframammary fold, or under the breast crease. You can see here before and after. This patient was looking for a nice natural proportional enhancement. She did not want to be excessively big, as well as not stretching her tissues. You can see here from the 3/4 view that she has nice shaping and improvement of the volume of the breast. And realistically, she went from an A to a full B to small C. And this is her from the side view. Again, you can see natural shape and contour to the breast, fullness, as well as the scar, which is tucked right in the breast fold, which allows it to be hardly visible for patients. Here's another example of a patient who underwent breast augmentation with smooth, round silicone gel breast implants. Again, her scars are tucked right in the crease. They're virtually impossible to see unless you lift up the breast off of the chest wall with your hands. You can see afterwards she has nice improvement and fullness in her cleavage area. A lot of women are looking to accomplish that, and it's very achievable with implants based upon patient's anatomy. Here's the side view of the same patient showing improved fullness in terms of the projection of the breast as well. This is a 3/4 view, again, to see natural. This patient in a bra or even a sports bra at the gym would not stand out as being over-augmented or look artificial. Here's another patient who has very little breast tissue. So as you're aware, patients come in all shapes and sizes, and some have more breast tissue than others. The goal of the surgery is to create a shape that we can to optimize the tissues projection of the implants with their tissues. This patient with very little breast tissue, so she naturally looks a little bit rounder and fuller because the implant is naturally going to show more because of her lack of thickness of her tissue. This is her side profile view, which you can see the implants there. And this is what we call the 3/4 view. You can see she has a nice defined lateral breast sweep or crease there. These implants are all placed under the muscle and again through the incision in the breast fold. Here's another example. Again, a very fit athletic patient, very minimal breast tissue to start with. And, she was looking for a moderate improvement, just a proportional enhancement of her overall volume. And I think we definitely achieved that for her. Again, scars are tucked nicely in the fold and the crease. She goes from an A cup to a probably moderate to small C, depending on where she buys bras. This is also a same patient, 3/4 views to see the shape that we've able to achieve. And we've done with the implants for her. And again, recovery is very quick when it comes to activity and levels of exercise. We talk to patients about that a lot when they come back in and give them our guidance about what they are allowed to do as early as a couple weeks out from surgery. Another example, again, very minimal breast tissue to start. You can see how the breast, in this case, the implant helps to shape the breast, allow for upper pole fullness, that's the upper portion of the breast, and to achieve some fullness and roundness that the patient was lacking. Oftentimes patients will ask about or read about fat transfer to the breast, and that is not really comparable to breast implants. You can achieve results like this with that. It can help in some patients who have very, very minimal hollowing of the breast that are just looking for a very subtle enhancement, or to women who have had reconstructive procedures that need to have some improvement in the thickening of the tissues. But currently with the technology, fat in and of itself cannot create the roundness and fullness of a breast that an implant can. This is an example of a breast lift in combination with an augmentation. So many patients, especially women who have had a few children and pregnancies and breastfed, will notice that they're not only are they lacking in volume of the breast that they would like to improve, but they would also need some skin removed because they have excess stretchy skin or the nipple, which is located in a lower position on the breast than they would like. So oftentimes as surgeons, we have to balance both factors in that we have to use an implant to improve the volume in addition to doing a breast lift, which is also called a mastopexy. The benefit of this procedure is we do it at the same time in the operating room in one session, and it allows the tissue to be improved as well as the volume. This is an example of a patient who would be considered a candidate for breast augmentation with a lift. She starts off with her nipples a little bit asymmetric, but also they're low on the breast. And so if you use an implant only in a patient like this or a similar patient, the problem you run into is that the tissue and the nipple position don't match up with where the implant ends up. And so we oftentimes have to lift the nipple and areola and create a better shape. If you look on the after photo, you can see here she has what we call a lollipop scar. So her scar pattern goes around the areola, which is the circular area around the nipple, and then down like a lollipop. It also connects to the tissue or the incision under the breast, which again, you can't see, which is what is utilized to put the implant in. This is also called a vertical mastopexy. There's a variety of names for it. Lollipop scar is also one that you may come across. And we use this in patients who need a lift in addition to implants. There's another version of a breast lift with implants that's called a donut lift or periareolar mastopexy, and that involves a scar just around the areola and then under the breast crease to put the implant in. In those patients, they do not have the up and down or vertical lollipop scar. The benefit of that is that for patients who don't need quite as much skin removed, I can achieve a good result in them without having to add the vertical scar. But as you can see here in this photo, she's about 9 to 10 months out. The result is actually quite good. The vertical up and down scar tends to fade very nicely as time goes on. And it really, when it is required, really does a good job of improving the overall aesthetics of the breast. This is the same patient from the side three-quarter view. You can see a little bit of the incision coming down from the areola. The vast majority of patients do retain their sensation to the nipple and areola afterwards, although in the beginning it can be a little bit numb, which is normal. 90+% of patients go on to have normal sensation long-term. So as mentioned earlier, we offer in-person consultations as well as virtual consultations. The phone number you see here on the screen today is our office phone number. I would encourage patients, if they've been thinking about learning more about cosmetic procedures of any kind, whether it's facial procedures, breast, body, arms, contouring, as well as thighs, we really offer virtually any type of surgery that's been proven to be safe and effective, in addition to a wide variety of non-surgical options, which may be a good starting point for some patients. That concludes the webinar portion today, and we're going to go and transition over to our Q&A kind of chat session. And one of the first questions that popped up on my screen was, what is the recovery like for submental liposuction? Do you have experience with buccal fat removal? So submental liposuction refers to liposuction in the neck area here. Submental is just a medical term for under the chin. That is a very easy recovery. In fact, patients are oftentimes not even put under anesthesia completely. It's more twilight. And the incisions are about 1 to 2 millimeters, one under the chin and then behind the ear and then behind the opposite ear. Pain level is so minimal to that we really don't even prescribe any pain pills. After the surgery, patients are in recovery room for about half an hour, and then they're able to be home. They do wear a compression garment under the chin for about a week. So if you can work from home or try and stay low profile, that will be easier. But pain level is literally about 1 to 2 out of 10. Patients look good enough in a week to go without the chin strap and be out in public. Results are visible in a week and continue to improve over time as swelling goes away. So it's one of the easier areas to have liposuction performed on. Somebody else posed the question here. Do you recommend getting both abdominoplasty and breast augmentation at the same time? Generally speaking, most patients like it that way. If you look at it from the perspective of it's one anesthesia and it's one recovery and it's one surgery. That doesn't mean every patient does it that way. There are also other considerations. But if patients are healthy and have no significant medical problems, these surgeries are typically done together because patients typically like it that way. Sometimes patients will opt to separate them. And if patients are coming in for massive body contouring procedures like big makeovers after weight loss, I tell them I am limited with what I can provide in surgery for about 5.5 to 6 hours of surgery time. And if I can't accomplish that safely and effectively, then we do recommend oftentimes breaking up the procedure into two. But I would say the vast majority, probably 75 to 85% of our patients opt to do the surgery together because of the recovery and the benefit of having one surgery and one recovery. Another question popped up. What is the recovery like for full tummy tuck? Well, it's certainly better than it used to be. For most patients, it depends on what you refer to as recovery. Is it when can I get back to work or when can I get back to my CrossFit, boot camp class? And those are obviously different. Most patients are able to get up and walk after their full tummy tuck. Again, that tap block has made this process much faster and much better for you. Patients are moving around the house normally afterwards, but a little slow. Typically, I would say if you have little kids, it's not something that you're going to have surgery and 3 to 5 days later be driving carpools and errands and lifting kids in and out of car seats and cribs. So you do need help if your children are younger and require that type of attention. Typically, I tell most patients they can take, if you go into an office type job outside the home, take about a week off. Most patients feel comfortable at that point in time to be able to drive themselves to their job and get through the day. They're going to be a little bit fatigued in the beginning as your body adjusts to that. But again, it's all about listening to your body. In terms of athletic recovery or working out, typically walking is what I restrict you to do in the beginning until I see you back. And then we give you a program which highlights each week of recovery and what you can do. And it basically starts with light cardio and builds up to more resistance activities and weights and things of that nature. So there's a lot of things that you can do between your surgery and 6 to 8 weeks. Generally speaking, with most patients, once they hit the 6 to 8 week mark, I give them no restrictions when it comes to exercise classes or vigorous physical activity or lifting. Another question here was, if you saw a patient that wanted a breast lift, would you recommend an implant if they'd had a better look with that? And the answer is yes. ultimately the goal is that we want you to be happy. We want you to look better and feel better about how you look. And oftentimes women will come in and want a breast implant, but not necessarily the lift. But if they really need both, the goal is to educate them about the benefits of the procedure. Some women oftentimes are candidates for just doing a breast lift alone. That's called a mastopexy. And the mastopexy basically is taking your tissue, reshaping it, lifting it, and making your breast perkier and not adding an implant. For some women, they really don't want an implant for a variety of reasons because of the volume. They don't need any more volume or want any more. They just want their breasts to look a little bit more youthful. And that's where a breast lift alone comes in. What it really comes down to is the physical exam. When Dr. Bengtson and myself, when we examine you, when you're here for your consultation, we talk to you about how much of your own tissue you have and how will that translate to a surgical outcome. Many times we do recommend that patients consider an implant because we know from our experience that patients are going to be happier with a little bit of volume in addition to the lift. So hopefully that answers the questions. Not everybody needs both, but the goal is to educate you about what outcome is going to give you the best result. Another question, what is the ideal way to do an abdominoplasty? Do you ever reject people until they get to a certain weight? Well, typically with any type of elective or cosmetic surgery, we want to maximize your health beforehand. That's where vitamin and healthy living and lifestyle choices come in. In terms of weight, we like patients to be around 15 pounds or so from their goal weight. So if a patient comes in and sees me and says, yeah, I'm about 10 to 15 pounds maximum where I want to be, doesn't hinder scheduling surgery. If someone comes in and is significantly overweight and has to lose 35, 40 on up, then we typically recommend delaying the surgical procedure. Number one reason is because complications of surgery are higher in patients who are considered obese or morbidly obese based upon the BMI calculation. And number two, the result is not going to be nearly as good as compared to a patient who loses weight and has more loose skin that I can then remove in surgery. So that's the benefit for patients being close to their goal weight. It's their health, the complication risk, but also, again, achieving a better result. And for most patients, if you're 40 pounds overweight and you have a tummy tuck, you'll look different, but you won't be maximized. If you lose weight and get closer down to close to the ideal weight, if not exactly there, the benefit is you're going to look better because, again, the result will show through more and will look better on you. So we counsel patients that weight can be a deterrent. Also, health status can be a problem. If there's a lot of medical problems, we want patients to optimize that ahead of time. Some medical issues can be fixed, whether it's weight loss or smoking, things like that. Other things are harder to do. And that's why, again, during the consultation, we perform a thorough physical evaluation as well as looking at your medications and any past medical procedures to see how those may or may not influence our decision to offer you surgery. In terms of another question here, is there a guideline to how long breast implants should remain in place, or do they have to be replaced every 5, 10, 20 years? That's a great question. So the answer is no specific guideline. There's definitely a belief out there among lay people in the public that there's a set time where you have to come in and have surgery because you've reached year 10 or year 8 or year 12. And that's really not the case. The current lifespan of the silicone gel implants that we use because of their advanced technology is somewhere between 17 to maybe 22 to 23 years, okay? So they are not lifetime devices. If you have breast augmentation when you're 25, it's highly likely you're gonna have another surgery probably sometime, in your 40s or mid-age time frame. And that's because eventually the implant shell may form a little tear in it and cause a little bit of a rupture. That in and of itself does not cause any medical problems for patients. In addition, a lot of women don't know that their implants are ruptured because the silicone gel implants keep their shape. So your breast could essentially look totally fine and feel totally fine, but have a small rupture. If patients have any concerns, we're happy to image them again with our high resolution ultrasound and or refer them out for an MRI. If your implants are ruptured, we do recommend removing and replacing them. And the implants that we use are warrantied for life. And so the company that we use our implants, that makes our implants, will help cover some of the costs of the procedure in the future for removing and replacing them. So as I summarize it to patients, it's not scheduled maintenance, but if you're young, hopefully you have many decades of life ahead of you, you will eventually want or need another surgery. And typically that surgery is a fairly easy process, easier recovery even than the first one, and patients tolerate it well. But To summarize, there's no specific date that you have to come in and have surgery. If your breasts look great, feel good, and you're happy with them, then of course we just tell you to leave them alone, and we're happy to have you follow up with us if there are any questions in the future. That's an important one because a lot of patients read. There's a lot of information out on the internet, as we all know. Some of it is good, some of it is a little bit questionable. So I recommend reading legitimate sources, either information we have available on our website or websites such as the American Society of Plastic Surgery or American Society of Aesthetic Plastic Surgery. All right, that's the end of the questions at this point. We'll give it another couple minutes if there are any other questions out there in regards to the surgery and recovery. The goal for today's webinar was to really talk about recovery, because I think that in the many years I've been doing cosmetic surgery, one of the barriers to considering having surgery is recovery. Patients are often concerned about, how am I going to feel? What's the pain level going to be? And when can I get back to activities, both just normal basic activities, but also more strenuous activities. And the goal of today's webinar was to educate patients out there who may be considering a procedure about all of the new techniques and advances that we have at our disposal to really optimize your recovery. Again, it's still surgery, and we ask you to plan accordingly, but utilizing excellent technology has made the recovery a much, much better process for all patients. Also, another question here. I've seen where people are numb after a tummy tuck. Is that normal? Does it go away? So the answer is yes, totally normal. Most women or men, again, are numb after the tummy tuck because of the way that the procedure is done. It's very normal, and it does get better so that you have much more sensation when you are 10 to 12 months out from the surgery than you do at 2 to 3. It's a time-dependent process and really does take up to a full year, if not past, to get back to your much more closer to your normal level. There may be small patchy areas that are always numb, but they're so small that most patients do not really notice any significant issue related to that. But yes, can be numbness. Almost all patients have it to some degree, but it gets significantly better as you get out closer to the year. Another question here regarding compression garments. Have compression garments improved at all? The answer is somewhat. We really look all the time at improving compression garments, because what compression garments are, for those patients who may not understand, is that after surgery, especially with liposuction or contouring, we like to put you in something that's tight and snug, because that helps reduce your swelling, whether it's for your arms, breast, or your body. They're worn typically under your clothes, and they're easy to hide from people, especially in the wintertime when you're wearing thicker and bigger clothing. There are some new brands out there, and there are also some that patients can buy on their own, kind of at the department store, that really accomplish the same things as some of the more bulky or medical compression garments. So depending on the surgery, we may promote you utilizing them up to 4 to 6 weeks afterwards, depending on how you're healing. Ultimately, with compression garments, as I tell patients, at a year, you're going to look the same whether you use them or not. But at 6 weeks, if you use a compression garment and you use it really pretty consistently, you're going to look better faster, because it helps to get rid of some of the swelling. So that's sort of the basic way of answering that. There's lots of options now. I would say that options are much better now than they were 10 years ago, when you had only what medical companies would make. Now there's a lot of over-the-counter type of things you can go to stores and buy, like Spanx and shapewear, that really accomplish the same thing, and I'll often recommend patients consider that. All right. So those were all great questions in regards to aspects of the surgery and recovery. Again, I encourage patients to, if you haven't been able to see the office, we'd love to have you in for an in-person consultation, or if you feel more comfortable starting the process from home, also a virtual consultation as well. You can see here on the screen our phone number, and we'd encourage you, if you've been thinking about it, it's always great to gather information and take that first step towards achieving the new you. I hope this was enjoyable for everybody today, and I'm happy to answer questions in the future. If you do have them, they can be directed to me at Dr. Alfonso, DRALFONSO, at bcaps.com. Take care.